Drug diversion in hospitals has been called healthcare's hidden epidemic. MIDAS has created a solution to this growing national crisis. In healthcare, the disposal of unused prescribed medication is called wasting. Medication wasting is a part of healthcare that we rarely see, but it happens often in every hospital, in your hospital, almost 1 billion times each year. The problem is that the way wasting is handled today is backwards, disorganized, and deserves a high-tech solution. Why? Because doctors and nurses can divert medications intended for patients, opioids, anesthetics, other high-value medications, when they claim to have disposed of them. Imagine an impaired caregiver taking care of patients, causing untreated pain, or even worse. In order to understand this epidemic, we need to explain how drugs are handled in hospitals, surgery centers, and other care locations like nursing homes. When a prescriber orders medication for a patient, it usually is dispensed from an automated dispensing machine, ADM for short, similar to an automated teller machine, ATM, that only allows for withdrawals. Those ADMs, along with hospital policies and procedures, are secure and well established as standard practice. The system breaks down when the quantity of pills or injectable medications dispensed from the ADM is more than the patient needs. There are many ways for a nurse or physician to dispose of the extra medication: flushing it down the toilet, throwing it into the trash, or putting it in containers intended for empty syringes and vials. And all that most hospitals require of their employees who waste is a representation that they did it without any proof. That shouldn't be tolerated in healthcare. But it is. Those methods are unreliable, ripe for deception, easy to circumvent, and impossible to verify because the excess medication disappears. They enable drug diverters to take these dangerous medications for themselves, contributing to the epidemic of drug diversion. The MIDAS View system prevents diversion during the wasting process. Our unique combination of features, highlighted by our visual accountability processes, offers unprecedented control of excess medication, preventing the continued use of bathrooms and garbage cans as drug receptacles. The MIDAS View system provides a standardized approach to medication wasting, in compliance with federal regulations, all on a compact, easy-to-use medical cart. The heart of the View system is a tablet computer powering high-definition cameras. The cameras record not only the nurse or doctor doing the wasting, but the actual wasting process for real-time or subsequent review. DEA regulations require certain wasting events to have a witness observe the process, supposedly to ensure that it is done properly. But trying to find another healthcare provider to watch is time-consuming and can compromise patient safety. Quite often, the witness claims to watch, but actually just walks away. And that's okay with hospitals. It's not okay. The MIDAS View system streamlines the process of witnessed wasting by allowing another caregiver to watch remotely by video using a smartphone, computer, or tablet. This can save time and saves lives. The participation of the witness is recorded as well, avoiding unreasonable reliance on the honor system. In only a few taps of the screen, the patient, the medication, and the quantity to be wasted are selected. The user is then directed to deposit the waste into the designated wasting port, one for hazardous medications and the other for everything else. Once deposited, regular medications are chemically treated so they are now safe for landfills, satisfying the EPA. Another feature which provides additional deterrence against diversion was inspired by TSA security checks at airports. Randomly, View users are instructed to load the medication they're about to waste into a vial, which will be locked for confirmation testing at the hospital pharmacy. Hospitals can also set non-random screening criteria for collection of these test samples. A multi-layered, consistent approach to medication wasting, all reviewable by authorized personnel. The MIDAS View makes medication wasting as secure and properly documented as the prescribing and dispensing processes, and as reliable as making a deposit into an ATM. This novel, market-changing solution will dramatically reduce prescription drug abuse by doctors and nurses, safeguarding them and their patients from the terrible consequences of this hidden epidemic.